So hi friends, the previous X-ray which I put on the Instagram story was that of a 69-year-old female who presented with the complaints of left shoulder pain. Okay, so I've received mixed responses from the audience, out of which 30% have voted for degenerative, 28 for inflammatory, 15 for metabolic, and 20% for infective. So before I reveal the answer, let us first understand how do you approach an X-ray of arthritis. Let us first understand the basics of arthritis. So before we move on to the case, so let us first discuss the basics of each and every arthritis in brief. We'll start with a degenerative. It's an asymmetrical type of arthritis. It's usually monoarticular. Okay. The four very main important points in degenerative arthritis. The first one includes your non-uniform loss of joint space. Then the osteophytes, they definitely have to be present to label a case as a degenerative osteoarthritis, and erosions have to be absent to label a case of degenerative osteoarthritis. The only exception to this is your erosive osteoarthropathy, which is only seen in the region of hands. Okay, this is the only osteoarthritis type which can have erosions. The rest, all the degenerative osteoarthritis will never have erosions. Okay, so please remember the only exception to presence of erosion in osteoarthritis is your erosive osteoarthritis, and that is only seen in the region of hands. The bone density can be normal or increase because of your subchondral sclerosis. If you look at inflammatory arthritis, it's a symmetrical type of arthritis and is always involving more than three joints, so it is always polyarticular. The very main important points for this include your bone density, which is decreased because of your juxta-articular osteopenia. Okay, because of the inflammation, there is hyperemia, which leads to increased osteoclastic activity, which leads to increased bone resorption, which ultimately leads to your juxta-articular osteopenia. Okay. Erosion is definitely a feature of inflammatory arthritis. And if we talk about rheumatoid arthritis, the major type of erosions are your marginal or your bare area erosions. Okay. Osteophytes, they definitely have to be absent to label a case as inflammatory arthritis. And the type of joint space loss is definitely uniform. Okay. If we talk about the important points of metabolic arthritis, remember these 3 points. The bone density always remains normal. The joint space loss is absent in cases of metabolic arthritis. The joint space is maintained even till the late stages of the disease. Okay, if you talk about gouty arthritis, even till the late stages, even when the erosion, the bony changes they have occurred, the joint space is maintained. Osteophytes are never seen in cases again of metabolic arthritis. Erosions may be seen because of the tophi. Okay. And if you talk about infective arthritis, we'll say there is loss of the subchondral bone. Okay. Second, it will have a moth-eaten destruction pattern in the region of metaphysis along with your osteopenia. Okay, erosions will be seen and osteophytes will again be absent. Joint space loss will be there, but in the late stages of the disease, it can be uniform, it can be non-uniform also. Let us again move back to the X-ray and let us rule out the choices one by one, why it is not degenerative. Okay, the most common joints to be involved by degenerative osteoarthritis include your hip, knee, and your spine. Primary degenerative osteoarthritic disease in shoulder, ankle, and elbow is very rare unless until you have some previous history of trauma or any surgical intervention which has occurred. If you look carefully at the X-ray, this is the margin of the glenoid fossa and this is the margin of the humeral head. Okay. We do not see any osteophytes here. Okay, so if we say the osteophytes, these are absent here, and I told you the osteophytes definitely have to be present to label a case as a degenerative osteoarthritis. Let us see the type of joint space loss here. If you look carefully, it's a uniform type of joint space loss. Again, I told you the important feature for degenerative osteoarthritis is a non-uniform type of joint space loss. In this case, it's like this. It's a uniform type of joint space loss. Okay. What will a non-uniform type of joint space loss look like? It looks somewhat like this. Okay. Like more in the inferior part, less in the superior part. Okay. So non-uniform type of joint space loss is suggestive of a degenerative joint disease. But here we have a uniform type of joint space loss which goes against your degenerative osteoarthritis. Okay. If we look carefully, we do not see any subchondral cyst or sclerosis in this region. What we do see here is your juxta-articular osteopenic areas, and we have a erosion on the glenoid fossa region. Okay. So absence of subchondral sclerosis and cyst also goes against your degenerative osteoarthritis. And I told you, in degenerative osteoarthritis, erosions have to be definitely absent. So we have erosions present here. Okay. Two types. We have your marginal erosions here. Okay. So this is an erosion on the greater tuberosity of the head of humerus. So this is a marginal or a bare area erosion. And another erosion we see is an intra-articular erosion. So let us summarize. Uh, this joint is not one of the most common joints to be involved, primarily by degenerative osteoarthritis. Okay, the points which goes against degenerative osteoarthritis include your absence of osteophytes, a uniform type of joint space loss, absence of subchondral sclerosis and cyst, and presence of erosions. Let us move on to the second differential. Why it is not metabolic. Again, if somebody would present you with a case of gouty arthritis, okay, either he will be showing you X-ray of foot or hand. Okay, so please remember the most common joint to be involved in gout is your first metatarsophalangeal joint. So that is, you can say that the most common area to be involved by gout is your foot region. And in the foot, it's your first metatarsophalangeal joint, followed by your hands. Okay. Again, a shoulder is one of the most rarer areas to be involved by gouty arthritis. And if you look at the soft tissue swelling here, it's kind of a spread out soft tissue swelling here. It's not kind of a focal soft tissue swelling. Okay. The tophi, they're usually soft tissue density or soft tissue swelling areas, which are usually seen either adjacent to your metaphysis or to the diaphysis. And these are focal soft tissue swellings producing a focal contour bulge. Okay. These are not kind of spread out swellings. Okay. And wherever the tophi are present, they try to produce the erosions there only. Okay. So the most common type of erosion in your gouty arthritis will be your juxta-articular erosion. Okay. You can have marginal erosions, you can have intraosseous erosions, but they are less common. Okay, the most common type of erosion in gouty arthritis are your juxta-articular, followed by marginal, and followed by your intraosseous. Okay, but juxta-articular erosions will definitely be there if they want to show you a case of gouty arthritis or a metabolic arthritis. In metabolic arthritis, there is no joint space loss even till the late stages. In this case, we have a uniform type of joint space loss, so this goes against metabolic arthritis. Lack of lack of focal soft tissue swelling or tophi, lack of tophi, they also goes against metabolic arthritis. This is not one of the most common joints to be involved by gout. Bone density, we have juxta-articular osteopenia. Okay, that again goes against metabolic arthritis. I told you in metabolic arthritis, the bone density remains normal. Okay, and if you look at the type of erosions, okay, we do not see any juxta-articular erosions. Plus, the erosions which we are seeing here, we are not getting any overhanging margin sign. Okay, so which is a very classical characteristic sign for your gouty arthritis, which is your overhanging margin sign. Okay, we do not see that sign also here, and the erosions are marginal and intraosseous here. Okay, but for metabolic arthritis, we require at least juxta-articular erosions. Okay, so let us summarize the points which are going against metabolic arthritis. That is, this is not one of the most common joints to be involved. Lack of focal soft tissue swellings and tophi. Uniform type of joint space loss also goes against your metabolic arthritis. Bone density, there is juxta-articular osteopenia. In metabolic arthritis, the bone density has to remain normal. The lack of juxta-articular erosion, okay, presence of marginal erosions and intraosseous erosions, but without the overhanging margin side. Again, this also goes against your metabolic arthritis. Let us rule out the third differential, why it is not infective. Okay, the first osseous alteration which occurs in your septic or infective arthritis is your loss of subcortical white bone. If you look carefully in the region of the humeral head, the subcortical white bone is totally maintained. There is no erosions involving the subcortical white bone, or there is no loss of subcortical white bone on the humeral side. Okay. We do have erosion on the glenoid fossa, but the infective arthritis or septic arthritis has to involve the subcortical bone of both the articular surfaces. Plus, if I wanted to show you a case of infective arthritis, I would have shown you moss-eaten type of pattern in the metaphyseal region of the humeral head. Now, if you look at the humeral head in this X-ray, it is absolutely normal. There are no areas of osteopenia which are involving the metaphyseal region. Okay, so two important points. Number one, loss of subarticular bone. Okay, this is absent here, so this goes against infective arthritis. Metaphyseal involvement is also absent here, so this also goes against infective arthritis. Any type of erosion can be seen in infective arthritis, so this is not a differentiating feature. Okay, we also do not see any periosteal reaction, but the important point here is normal subarticular bone on the humeral head, normal metaphyseal region on the humeral head. So these 2 points both go against infective arthritis. We're left with the last differential, so that is your diagnosis. So this is a case of inflammatory arthritis. So this was actually a case of rheumatoid arthritis of the shoulder. Okay, shoulder again is less commonly involved, but if we go about all the four arthritis, the most amount of predilection for shoulder is for your inflammatory arthritis. Okay, osteophytes are absent, so this is in favor of your inflammatory arthritis. Type of joint space loss is uniform, again in favor of inflammatory arthritis. Subchondral sclerosis and cyst are absent. Juxtaarticular osteopenia is present. Okay, we have marginal erosions plus intraosseous erosions. Okay, so these all points, they are favoring your inflammatory arthritis. So that is why this is a case of inflammatory arthritis. We performed an MRI in this patient, which revealed. So these are your T2 weighted images. So this revealed a hypervascular pannus in the synovial joint space of the shoulder, okay, which was the cause of erosions in the region of greater tuberosity as well as your glenoid fossa because of the intraosseous extension of the pannus. So again, these are the same images, which is demonstrating your pannus formation in the synovial joint space along with the erosions and surrounding inflammatory changes. So these are your post-contrast T1 weighted fat site images. So these are showing your enhancement of the pannus along with the intraosseous extension of the pannus. Okay. So this case was labeled as case of rheumatoid arthritis of the shoulder.